Hey everyone, welcome back. If you're a nursing student gearing up for Dr. Kuykendall's Week 10 quiz, you are in the exact right place. We've put together this highly focused explainer to help you take all that dense material from chapters 24 and 25, synthesize it, and basically just crush this upcoming exam. We're going to zero in on exactly what you need to know about cognition and mental health.
But look, before we dive into all the heavy clinical details, let's just take a quick collective breath, okay? I know pre-quiz anxiety is super real. We have literally all been there, but we're going to channel some positive affirmations right out of the gate to set a really empowering, confident tone. You've put in the work, and honestly, you are totally ready for this. So read this with me. Seriously, say it out loud wherever you are. I am amazing. I can do anything. I choose to be positive. I know my worth. I will succeed. I really want you to lock in that exact mindset as we jump straight into some incredibly dense but highly testable material.
Okay, let's dive into this. Here is your ultimate study roadmap for today's session. We're going to cover our quiz prep strategy, assessing cognition, fluid versus crystallized intelligence, mental health and aging, recognizing PTSD and depression, and wrap it all up with those absolute must-know nursing interventions.
All right, kicking things off with part 1 of our high-yield study guide. The goal here is trimming the fat and focusing exclusively on the critical cues and actions you need for exam day. Moving into section 2, let's talk about assessing cognitive function, specifically that crucial first look.
So, stepping into chapter 25, you have to remember that assessing cognition starts the absolute second you lay eyes on your patient. It's all about their appearance and behavior right off the bat. Like, are they dressed appropriately for the weather? Are their clothes clean? What are their facial expressions and speech patterns telling you? That's your very first clinical clue. But when we get into formally assessing their level of consciousness, we're looking for what we call alert and oriented times 4. This just means you're checking if the patient is oriented to person, meaning they know who they are, place, they know where they are, time, they know the day or date, and event, meaning they actually understand what is currently happening. If literally any of these are off, you've got to investigate further.
Now seriously, grab your highlighters for this next part because you absolutely need to memorize the exact 3 steps of the mini-cog assessment. This is prime, high-yield test material. Step 1 is 3-word registration. This is where you ask them to remember 3 totally unrelated words. Think apple, pencil, telephone. Step 2 is the clock drawing test. And finally, step 3 is asking them to recall those original 3 words.
And here's how this brilliantly comes together for the scoring algorithm. If the patient recalls 0 words, that indicates dementia. If they recall all 3 words, they're classified as non-demented. Pretty straightforward, right? But what if they recall 1 or 2 words? Well, that's when you look at that clock drawing from step 2 as your tiebreaker. An abnormal clock means demented, while a normal clock means non-demented. Take a look at these examples to really anchor your memory on what we're looking for in step 2. This shows you what a normal versus an abnormal clock drawing actually looks like in clinical practice. Notice the spatial awareness issues in the abnormal ones? You might see a clustering of numbers all on one side, or maybe missing hands altogether. Recognizing these specific variations is just a really key nursing skill.
All right, on to section 3, covering the crucial distinctions between fluid and crystallized intelligence.
So there's this huge misconception out there that severe cognitive decline is just an inevitable part of getting older. But actually, while overall cognition generally remains pretty intact, even with a natural decrease in neurons and myelin, intelligence splits into 2 highly testable categories. So the crucial point is this hard contrast right here. On the left, we have fluid intelligence. This involves biologically determined skills and performance scales, and this one does decrease with age. But on the right, you've got crystallized intelligence. This is all that acquired knowledge from education and life experience, which we measure by verbal scales, and get this, it remains totally stable. Exam questions absolutely love testing you on this specific distinction, so lock it in. Transitioning into Chapter 24 material with Section 4, Breaking the Myths Around Mental Health in Aging.
Now, while baseline mental health is generally the same later in life, older adults often face some massive life transitions. We're talking loss of social support, shifting independence, and these play a huge role in their psychological well-being. So think about your future patients for a second. Is anxiety just a normal part of getting older?
The answer to that is an emphatic no. Anxiety disorders and mental health issues are not a normal part of aging. Things like early onset anxiety, physical frailty, cognitive decline, or chronic illness, these are distinct risk factors that trigger anxiety. They are not just normal aging. So never dismiss an older patient's anxiety as just, quote-unquote, getting old.
Moving right along to Section 5. let's look at the key cues for recognizing PTSD and depression.
As nurses, this part is absolutely crucial. Because older adults rarely report psychological symptoms outright, they'll usually just give you physical somatic complaints instead. You really have to know how to spot the specific cues. Let's look at post-traumatic stress disorder first, which can stem from military conflict, previous trauma, or even a stressful medical event. You've got to know these 4 major symptom clusters: re-experiencing the event, avoidance of triggers, persistent negative alterations in cognition and mood, and significant alterations in arousal and receptivity.
And when it comes to depression, you want to rapidly scan for these physical symptoms: insomnia, significant weight loss, chronic pain, hypochondriasis, and decreased energy. But also, look closely at those middle bullet points. Memory loss and cognitive impairment are on this list. Remember, in older populations, depression can easily masquerade as a physical illness, or it can even mimic dementia. You always have to keep your clinical radar up.
Okay, let's do a quick practice scenario straight from the source text to simulate what a real exam question might look like. An older adult client shares with you that he still has flashbacks to his experiences in the Korean War. You also notice that he's a bit jumpy, has startle reactions, and shows poor concentration. What exactly is he experiencing?
If you guessed post-traumatic stress disorder, you are 100% correct. Those flashbacks represent the re-experiencing cluster we just talked about, while the jumpiness and startle reactions are classic, textbook examples of alterations in arousal. Make sure you lock that clinical presentation into your memory for the quiz.
All right, bringing it home with Section 6, Crucial Nursing Interventions focusing on action and safety.
So identifying the problem is really only half the battle, right? Let's move to this chart and see how this builds, because your quiz is going to relentlessly test you on the specific nursing actions you have to take next. Safety and targeted therapy are your top priorities here. For depression, you're looking at cognitive behavioral therapy, or CBT, grief management, exercise, and antidepressants. For PTSD, we again utilize CBT, but we add things like prolonged exposure and EMDR. And for schizophrenia, the focus shifts heavily toward medications and environmental interventions. Use this as your rapid-fire study tool.
Now, this is incredibly important. If you are analyzing cues for suicide risk, these are your absolute, non-negotiable, life-saving interventions. Number 1, establish safety. You absolutely, under no circumstances, leave a suicidal patient alone. You call for help, you determine if the threat is imminent, arrange a safe escort by a reliable person for hospitalization, and you ensure the removal of firearms with family cooperation.
Wow, okay. We have covered a massive amount of high-yield ground today. If you review these specific cues, understand those differences in intelligence types, and memorize your interventions, you are going to be in incredible shape. Let's bring this full circle. Remember those positive affirmations from our very first slide? You know your worth, you have the knowledge, and you are absolutely going to ace this Week 10 quiz.
Before we wrap up, I want to leave you with one final, kind of provocative thought straight from Chapter 25 to carry into your actual clinical practice. We know the mind changes, and sure, fluid intelligence might slow down a bit. But as future nurses, what creative ways will you use to help your patients keep learning, no matter what their age is? Think on that one. Keep studying hard, and we'll see you in the next explainer.